drop is a banker. Down, I'm a rebel. Down, I'm a down, down.
Nation.net.
Free my brother, waiting they up my door. We cannot do and go die. Tell me waiting where you dey fight for. Say something, my sister, live life and find.
Alright, so welcome again to this channel, and it's Christmas, and so we're saying Merry Christmas to everyone and a Happy New Year in advance to everyone watching us on this channel. I will entreat you to subscribe to this channel, like, comment, and share this video so that we can get more views and get you more content as well. Today, on Christmas Day, I have with me the Executive Director of Health Ghana Foundation in the person of Dr. Sylvester Akpah, popularly known as Sly. Sly. Yeah. It's good to see you, man.
See you too.
Yeah. Same to you, bro.
Yeah.
Same to you, bro. All right. So, for the purpose of this discussion, but he is a PhD holder, but I'm just going to call him Sly. We are good to go. Yeah, we're good to go. Right. So, Sly. In fact, today is Christmas, and I'm so happy. I like the scene, and the atmosphere is very calm, very soothing, and that's the thing. Right in the sun, and we are having this discussion. Yeah. But whilst we are here, having some fun, we need to talk about activities we do, especially yourself, what you do, and the organization, the Health Ghana Foundation. You are going to give us the history of Health Ghana Foundation, how it all started, how many years you've been in the system, and then tell us what you are about to do, the years ahead, where you want to take Federal Ghana Foundation. Yes, sir.
Thank you so much. I wish our viewers a Merry Christmas and a prosperous New Year. We know that a lot of us have plans, some that we are able to achieve, some that we are not able to achieve, but we keep pushing.
Yes.
That's it. So I wish each one of us a prosperous New Year. Whatever activities or plans we have, let's keep pushing, and definitely everything will fall in place.
Right.
So as you rightly said, yes, we are located somewhere in the it's 25th December 2024,
Yeah.
and I think that it's just the best feeling everyone wants to have, being on the beach, just 25th December morning. Yes, so my name is Dr. Sylvester Akpah. I'm a lecturer at the Computer Science and Engineering Department of the University of Mines and Technology, and also the Executive Director of Health Ghana Foundation. Basically, this is a community NGO, as I would say, where yes, we have a lot of people who are part of this foundation. The NGO, I would say, started in July 2012. That was when the foundation was actually registered. Registered General Department. The focus to advocate for kidney health. You know, the organization started in Akpah. It started in Akpah, where, as we would say, it's the largest mining enclave in the whole of West Africa. And anywhere mining abounds, you know that there will be a lot of illegal mining activities, where mostly heavy metals such as mercury, cyanide are used to actually extract gold from the ore-bearing rocks. So when I got to Akpah, actually to start my national service with the University of Mines and Technology, and then having, you know, a close friend of my dad who passed away from kidney disease, having engagement with some professors on campus, and getting to understand that long-term exposure to these heavy metals actually can lead to certain vital organs, such as the kidneys, getting failed. Yes, I was actually, motivated to start an initiative. That's what. And more so, in 2012, we realized that kidney health awareness was very low countrywide.
Yeah.
Yes, it was very low at the time. even as we speak in 2024, it is still very low because we don't even have, you know, I'll say approaches for prevention. Rather, we have approaches for curative, where we have dialysis centers dotted in some parts of the countries. So realize that it is still very low. So I decided to actually start this NGO to advocate for kidney health and more so to make people aware that yes, the kidneys are vital organs in the body, and it's important that take the preventive steps to ensure that you're strong all the time. So that is how come Fem Health came to be in 2012 to advocate on kidney.
It's 2012. So we are in 2024, meaning that's 12 years.
12
That's great. That's great. We've come far. We've come very far. Right. So you actually initiated the idea. How have you been able to sustain it? Which people, which kind of people were able to support radios?
Yes, we noticed that. I think someone asked me this question some time back that, Doc, you are not a health person, so why an NGO advocating for health? Yes, I said it's passionate. So basically, what I did is that once I knew I was venturing into a health-focused NGO, there was a need to surround myself with medical persons, right? So now I started moving around hospitals, trying to create some connections, okay, with some medical persons, nurses, lab technicians, and all that. So that anytime we have any project, all these persons will come together for us to undertake these projects. And that is how it has been over the years. Till now, that I'll say that gradually we have a very solid medical team. And then Spoffers actually now move back to go and make sure that the operational side of the NGO actually functions so well. So yes, a lot of steps have gone through to ensure that Fem Health actually becomes sustainable as it has to be to our present day age. And I'll say kudos to all the medical team who are on board, headed by Dr. Joseph Dab, and then Gladys Fume. Gladys Fume, yes, she's not in the UK, but she's supporting us highly. We have Takono, we have Charles Abebu, we have Kwabena, Ajman, and all that on board, and all our volunteers. I think it has been a very good journey, and I think that there's still a lot more that we can do together. So yes, it's all about finding the right mix of human resources, and then us coming from the computing background, so we can actually use our skills to support the NGO to get to where it has to get.
All right. So on this note, I would want to say Merry Christmas to you, Madam Gladys Fume, popularly known as In Charge.
In charge.
Yeah, In Charge. Yeah, Merry Christmas to you. You are watching us from the UK, so we are saying Merry Christmas to you as well. In fact, at a point in time, I came to meet discussions on the health issues and I staff for the Health Ghana Foundation was very enormous. I must acknowledge that. Right, so you have all these gallant health practitioners on board, and you coming from the IT background. How are you able to put that together to ensure that the Health Ghana Foundation?
Yes, it's important. More so, now the world has gotten to a stage where data is actually very critical.
Yeah.
So if you look at the activities that we carry out, our community engagement programs, health initiatives, what I do actually from their computing background is to actually develop software that actually will help to collect data and then to bring up some data analytic tools to ensure that the data that we actually generate from our community engagements, we're able to analyze them properly to help us make informed decisions based on the stakeholders that we have at the time. If you look at the blood donation drive, I think Dr. Dago mentioned it. Yeah. That's one of the key areas that the Fem Health Ghana Foundation is focused. So what we have done is that we've come up with a software whereby we are looking at it that once the software deployed fully, anytime there is a need for blood in any hospital, we don't need to call and be moving around doctors to be asking them whether you have blood type O, you just jump onto the software. All the hospitals actually stationed with the blood banks. You're able to know instantly. You create the system, you're able to know what blood type is available at a particular blood bank at any point in time. And I think this is one of the innovative ideas that we are using our scale to actually support the NGO, which is very, very critical. And this project that we just did yesterday, the 24th, the journey with the agent and mental, actually that's also one other project that we believe that once it is actually executed properly, we are going to make a lot of to understand the health issues that are faced by the agent within our communities. So a software has also been put in place to actually collect data and also for the data to be analyzed. And based on that, the medical team will be able to make informed decisions based on the data that analyzed. And we are looking at it that we will be able to get a lot of stakeholders on board, I mean the private sector, so that through this we will be able to enter more communities to be able to understand the health issues that are faced by our elderly persons, which is very, very critical. Because as we say, the elderly are the more vulnerable persons within our community now. So kudos to Ghana National Gas Company Limited for coming on board this project with Family Health Foundation. And also, we believe that at least once we have other stakeholders come on board, we should be able to make a lot of informed decisions within this project.
Right. So you started in 2012 and we are in 2024, going into 2025. In the coming years, how would you want to see Family Health Ghana Foundation in the coming years?
Yes, so we have a lot of plans already. So what we are looking at is that we want to strengthen our collaborative arm, where we want to touch base with more industry players. Presently, we have Ghana Gas on board. We have a project with Ghana Gas again, somewhere much around the Pristia enclave. We're also having conversation with the Anglo Gold Ashanti for them to take over our quarterly blood donation drive for the entire 2025, which is a very good initiative. And then also trying to establish links with our foreign partners. As we speak, we are engaged with the University of Montana State, where they will be coming. We have persons coming to Ghana next year, 2025. They are coming to understand the health structure in Ghana. Specifically, they will be based in Akpah to understand the entire health structure within the Western region, with particular emphasis in the Akpah and Bogoso municipalities. These are some of the things that we want to do. We want to continue establishing our links with industry. We want to establish our links with academia, because research is also one of the critical things that Family Health Ghana Foundation wants to build strongly. So I believe that once we're able to put all these things together, it's really going to position the NGO to be able to make a lot of impact within the communities that we live in.
I want to thank you so much for your time today. And we are looking forward to seeing the Family Health Ghana Foundation and that particular top level where the World Health Organization and even the government that is all that, and where we can have a lot of partnerships that will turn into that level. Thank you very much.
Thank you so much.
I've been speaking to Dr. Sylvester Akpah, the Executive Director of Family Health Ghana Foundation. He's popularly known as Sly. And when you mention him, Sly, he used to smile just like a smile. Right. My name is Thomas Tete, call me TT. And I would thank you so much for being part of this program. God willing, another time we'll come to you wherever you are. Any part of the world, if you're watching this particular channel, make sure you subscribe, you like, you comment, share. Thank you very much. Have a Merry Christmas and a great day.